Good evening and welcome to our COVID-19 update. I'm Ladi Akeredoluale. Here are the highlights at this hour. European Union promotes safe and nutritious food as part of COVID-19 containment strategy. World Bank donates more than 500 pedal hand washing machines to Yobe State. And WHO says Africa cannot afford a second wave of COVID-19 infections as the effectiveness of the drug remdesivir is called to question. We begin our bulletin tonight from Yobe State, but actually even before Yobe State, we're in Taraba State, where the European Union says preserving access to safe and nutritious food is and will continue to be part of an essential response to COVID-19 pandemic, particularly for vulnerable communities hit by resulting economic shocks. According to the European Union, over 2 million people do not have regular access to safe, nutritious, and sufficient food at the moment, adding that the COVID-19 pandemic could add between 83 and 132 million people to that figure. Represented by the project manager of Oxfam in Taraba State to commemorate World Food Day, the European Union insists that the COVID-19 global health crisis has now become a time to reflect, rekindle, and appreciate things truly cherished.
It is pertinent to recognize and support the state food heroes comprising of farmers and workers throughout the food system, making sure that food makes its way from farm to the populace in unprecedented time of the current COVID-19 crisis in a more transforming means of sustaining livelihood. Our future food systems need to provide affordable and healthy diets for all and decent livelihoods for food system workers while preserving natural resources and biodiversity and tackling challenges such as food preservation and climate change. Over 2 billion people do not have regular access to safe, nutritious, and sufficient food. The global population is expected to reach almost 10 billion by 2050. Nearly 690 people are hungry, with up to 10 million since 2019. The COVID-19 could have added between 83 to 132 million people to this number, as dependent on the economic growth scenario. Approximately 14% of food produced for human consumption is lost each year between the stages where it is grown or raised up to when it reaches wholesale market.
Meanwhile, a World Bank-funded project, the Multi-Sectoral Crisis Recovery Project, has donated 510 pedal hand washing machines to the Yobe State government to be distributed across schools. Our correspondent, Musa Mingi, reports that the items are aimed at strengthening the fight against COVID-19 in schools while the students undergo their studies. The state coordinator of the project, Edie Jidawa, also says the agency is setting up 2 molecular laboratories at the State University Teaching Hospital in Damaturu and the Federal Medical Center Nguru for COVID-19 testing. Yobe State has recorded 76 confirmed cases only, among which 24 are healthcare workers.
We are here to present the hand washing equipment to the COVID committee, Yobe State, for onward transmission to the Ministry of Health, the Ministry of Education, for safety of schools. So going further, I would like to add that the issue of COVID in the world, I think, is a known fact to everyone of us here. And we are very much fortunate that Yobe has been on the forefront in the fight and against the pandemic. So it is in line with that the Yobe State deemed fit to factor in within the state investment plan of the MCRP the procurement of all kind of materials needed to fight the pandemic.
Moving on to the southwest, where in Ogun State, Governor Dapo Abiodun has assured both local and international investors in the agricultural sector of its economy and its value chain of flexible land policies. He made the promise in Abeokuta, the capital, while addressing participants at the celebration of this year's World Food Day held at the Arcade Ground at the governor's office. While calling for improved food production, the governor, however, says attention is being focused on the sector in the post-COVID-19 economic recovery plan of the state.
Is and will continue to be an essential part of our own response to the COVID-19 pandemic, particularly for the poor and vulnerable communities who are hit hardest by the pandemic and resulting economic shocks. Distinguished ladies and gentlemen, the most important point for today's celebration is for countries all over the world to make human nutrition a major plank of their recovery plan from the COVID-19 crisis and make food systems more resilient and robust. And as countries begin to develop and implement COVID-19 recovery plans, it is an opportunity for everybody to adopt innovative solutions so that we can all build back better and improve our food systems. This will further help the people to withstand increasing volatility and climate shock, deliver affordable and sustainable healthy diet for all, and decent livelihood for food system workers. Permit me to say that agriculture occupies a unique place in the economy of Ogun State. It has always been the mainstay of our economy. In the recognition of this fact, our administration made agriculture a major pillar of our government's Building Our Future Together agenda. And in fulfillment of our electoral promises, we are putting in place many programs to enhance the fortunes of our farmers and encourage our people to return to the land. On the employment generation agenda, the CBN Anchor program on agriculture was flagged off on Friday, 6 September 2019, while the Fadama Graduate Unemployment Youth Scheme, GUIDE, was also launched on Thursday, 29 August 2019. Both are directed at two vulnerable groups of our population, the women and the youth.
In Delta State, its chapter of the National Association of Nigerian Students and the National Executive of the National Association of Delta State Students have alleged a 5,000 naira levy on every student by some tertiary institutions in the state for COVID-19 prevention and safety materials. They spoke during a courtesy visit to Governor Ifeanyi Okowa, where they called on the governor to direct the higher institutions in the state to scrap or reduce the COVID-19 levy on students, insisting it's a huge burden on them and their parents, especially in the prevailing economic situation in the country. In reacting to the complaint, Governor Okowa says that government is not a part of the decision and assures that he will find out the true position of things and address it.
Delta State is, if not the only state, one of the few states that are still paying bursary. And the students don't take that for granted. So, sir, this year bursary, the registration was done earlier this year, and there is a policy in the board, which is the physical verification. I've written to your officer that if there is a way it can be romanced because of the pandemic that does not support large gathering these days, asking for students to come together for physical verification is like bringing so many crowds together again. We are begging and we are appealing, sir, that it should be, if it can be, not bypassed, I say, but romanced so that it can be reduced to the barest minimum, where this bursary will still be paid without the physical verification.
I'm aware and I'm told that you already have meetings with the Commissioner for Higher Education concerning the issue you've raised on the COVID-19 pandemic. And though the institutions are near, I use the language very carefully, they are near autonomous. So that is what they did is a decision that they took on their own, not on my table. And I cannot just rise up to take decisions on their table, but we'll discuss it. I'll discuss it with the commissioner. And if it's not possible to scrap it, they will I'll try to push for them to go down on the amount of money that is requested.
The Archbishop of the Anglican Communion in the Northeast has appealed to the federal government not to slow down but intensify efforts in the fight against COVID-19 in spite of the low cases recorded recently in the country. The Archbishop made his comments during the commissioning of a new Secretariat of the Communion and celebration of 30 years of the Yobe Diocese. The cleric warns that it is not yet over because of what he believes as a full-blown community transmission that is now ongoing. He also appeals to authorities to ensure that palliatives get down to the grassroots. He also appeals to Nigerians to strictly adhere to the COVID-19 regulations put in place by the federal government for the good of the people.
So if such people who are world powers can be positive under COVID-19, then who else will be spared? So I want to call, what the government is doing, let me appreciate their efforts thus far, but I think that effort should be redoubled. The government should do more. Because if in Adamawa State, I know of many great men that died in Adamawa State as a result of the COVID-19. So we should be strictly compliant to the rules given against COVID-19, not only within the nation, but globally, for the good of our people. Face mask should be applied, social distance should be encouraged in whatever that we do. Honestly, is not shared equally. And even in the Bible, they will have the case of Acts chapter 6. Because the people are not given share of what they should eat, people murmur and complain. In the Bible, they murmured and complained. And today, even in this country, people are murmuring and complaining. So I call on the federal government, whatever you will do, please do it well. People who are under this COVID-19, people who are dying because of hunger, they should be looked upon. You should care for them. They should get what they should eat. Not just as few should be enjoying the benefit of this issue of COVID-19. I don't want to mention anybody, but you know what I'm talking about. You are hearing me, you're listening to me. Please do justice. The epilepsy we're talking about should be given to everybody to enjoy it, not only people, only few to enjoy it.
The Archbishop of the Anglican Communion in the Northeast. The Lagos State government says a total of 181 students and staff members of a private school located in Lekki have tested positive to COVID-19. The Commissioner for Health, Professor Akinbayomi, who broke the news today, said during surveillance and case investigations in the boarding school, there were 141 students and staff present. Giving details of the investigation, Professor Abayomi explained that a 14-year-old SS1 female student fell ill on the 3rd of October and was sent home after receiving first aid at the school. He says the student subsequently tested positive for COVID-19 on Tuesday, the 6th of October, in one of the accredited private laboratories in Lagos. The Commissioner assures Lagosians that the state government, through the Incident Command System, has the situation under control, stressing that appropriate steps have been taken to contain the spread and manage the positive cases. Professor Abayomi says all parents have been contacted and cancelled via family Zoom call on the 13th of October to further allay fears, and communication between school authorities and parents continues. The Zoom call was said to have been attended by the Commissioners for Health and Education as well as all relevant responders. Professor Abayomi says there's a total lockdown and restriction of movement in the school, with the epidemiology and surveillance team reporting at the school daily to conduct further investigations, while positive students and staff have been isolated on the premises and given the COVID-19 home care treatment parks and are being monitored in isolation within the premises. Professor Abayomi's statement also states that the school authorities, supported by the State Ministry of Health and the Ministry of Education, are following the COVID-19 guidelines and set out by the government. Let's talk now to Dr. Ganiu Jamiu, who is a public health physician, joins us via Skype from the Bagada area of Lagos. Dr. Jamiu, thank you for your time. Welcome to the program.
Thank you. Good evening, Mr. Ladi.
Just this last story, is this what we feared? could happen when we were reopening the schools?
Actually, that has been one of our fear, not only in school, even in other areas. It's really unfortunate that we're witnessing such a situation in that particular school in Lekki. It calls for concern, and I want to believe it's an eye opener in the sense that, from look of things, I think we need to a kind of step up with our monitoring the appropriate. As I say, when we're talking about issue of compliance with non-pharmaceutical measures at the early part of this partial easing or lockdown, we talk about need for proper monitoring to ensure compliances. I think with this, I'm suggesting that the state government should put in place necessary measures in terms of ensuring that schools are properly monitored. And I want to believe, this virus actually spread more in clusters. That was why I could, out of 441, we're having about 181 cases. Because, it's a boarding school that are clusters in one place. So these are a real opener in which I think we need to actually ensure proper monitoring of all the schools that currently are open to for learning. Thank you.
Professor Abayomi's statement is very detailed as it explains what the government is doing, what the authorities are doing, what the school is doing, and how this is being contained. Bear in mind, of course, that this is a private school. So if this were to replicate itself in a public institution at that level, perhaps the reactions or the response might be a bit different.
Well, I don't think it will be a bit different in the sense that we are all being guided by the same protocol. I just wanted to believe, maybe I'm not part of that investigation. I think it's proper. I'm sure they will have done that to actually know whether they actually comply with the COVID protocol for school. Because it's really, if actually such school, I'm not blaming anybody anyway, they comply. I don't think we should be envisaging such kind of situation. So I think that there should be proper investigation so that the lesson from that can be used to, improve on other area and to guide how the protocols are being, complied with in other schools, whether public or private. So I think proper investigation needed.
Why do you think they did not move them to isolation centers? Why are they giving them the home treatment strategy within the school premises?
Yeah, but, I think, the school is also has some facility, it's a boarding school. So I think what they just needed to do is to, isolate those that are positive to maybe one of the dormitory and restrict their movement from, mixing up with other non-positive students. I think that is a good measure, which I think we are not praying, but I think they are working in line with the appropriate protocol. They don't need to move because the whole mark of isolation center is just to isolate those that are positive and offer them appropriate management, especially for those that are symptomatic, and for those that are not symptomatic, just to keep them under watch to see until when they see the the incubation period and the test confirm they are no longer positive. I think it's proper that they restrict them to that school because movement again will also be exposing other people and so on. So, and it's safe cost by even keeping them in that same school. Yeah.
The issue of testing has been brought to light here. This was discovered because the first, I don't know if one can call it the index case in this matter, went home and was tested, and that was why everybody else who had been involved was quickly isolated. And so, how important is this kind of quick testing in this kind of situation? Since you say this develops in clusters.
Yes, it's very important because without that, that index of suspicion, I learned that the later student actually developed symptoms was on 3rd of October or so, and as at 6th, she was confirmed to be COVID-19 positive. I think with the current pandemic, and that's the current thing anyway, and if anybody should fit into the case definition, I think it is appropriate that, considering the fact that that is what we are in currently, and I'm applauding the Lagos government for initiating that on time. If not, it will have maybe we will have been talking about a larger number of people that are contracted. I think the testing, the quick, turnover of testing, getting the testing on time, and carrying out proper surveillance case investigation has actually helped out in quickly identifying those that are positive. And I think I commend Lagos State for that.
Okay, I said I was going to press you a little bit about the issue of testing, because that's
Yes.
what this case of this school in Lagos has brought to fore, and you've just talked about how important it is for there to be quick testing, quick turnaround to be able to know how to respond. On a national level, everybody now knows that we are not doing anything anymore. We're not testing. Even the presidential task force yesterday talked about only two places having tested 1%, Lagos and Abuja. Then an additional couple of states in the single numbers have tested 50% of 1% of the population. The rest of the country, 25% or less of 1%. And that number is not increasing. And yet you talk about how important is it to test. What are we supposed to do?
Good. Like what happened in Lagos in that boarding school should serve as an eye-opener. I want to believe the presidential task force have got information about this, that this virus is still with us, whether we like it or not. For us to have 181 from 441 is really alarming. So I think this information needs to be passed across so that we can wake up, especially as we continue to open our schools. We need to put some of these measures in place. Had it been Lagos says didn't have some of these measures in place, only God knows what would have happened. And that may have spread to even affected the relation, affect everyone, maybe spread to other schools. So my advice is that there should be continual advocacy so that those states where testings are not taking place now, they can be alerted and advised to, especially as part of surveillance in our various schools, in our public places. Because whether we like it or not, this virus strive more in clusters. And our boarding school, they just opened our Unity school, was the 12th of this month. So we need to actually, try to see how we can put logistics for testing. If we are not even doing it on the larger scale, but our schools, our public places, civil servants are to resume our next week again. So government need to be properly advised. The appropriate stakeholders need to be advised on the need to make logistics for continual testing. I think we go a long way in a kind of avoiding what just happened, or I was avoiding, and apart from avoiding, also helping to be able to appropriately respond to in case such kind of incidents occur in other places. Thank you.
The way this thing is, what people like you have told us ever since it began is social distancing, frequent hand washing. Yesterday was Global Hand Washing Day, so we had a lot of water and people talking about water and why it was present. But the most visible sign in terms of the protocol is the issue of mask wearing. Now, a lot of people complain that it is extremely inconvenient to wear. And some of those complaints relate to the amount of time you have to wear it for. You've just mentioned now that civil servants are resuming work. For many of them, they share offices. Many of them are in cubicles with other people and so on. So the issue of masks means that they've got to be on those masks for very long periods of time. Do you harbor any fears about medical dangers involved in this? How best can people do this in a safe way, do you think? Wearing of masks for a very long time.
Okay. Well, we are now in a new normal, whether we like it or not. We just have to adjust to that. By so doing, what I will advocate is that we have to look at the quality of kind of mask, the kind of quality of material we are using to produce our individual mask. It has been recommended that those ones that ensure breathability, that people can breathe very well, and those ones made up of 100% cotton. It's not all material that can be used for face mask, or the use of bamboo materials. And those bamboo materials, apart from the issue of ensuring breathability, it has also been found to have that sustainability effect. And in the situation whereby people can also afford the normal surgical glove, which is very, is made up of loose materials with losing, easily adjustable with metallic features to ensure that it is properly placed. If you can have that, our advice is a material that for those that want to be using their own personal mask, we just have to, cope with the new normal. I will advise that they ensure that they use the right material for for the production of their mask. So that's what should be we should advocate for. And I think it will not cost the government anything if we can also make a provision to distribute masks, all these handmade, locally made masks that are made up of this material I just measured. It will go a long way. But whether we like, we have to, continue to, bear with the current new normal, because we can't just do without it. But apart from even the mask, it's not mask. Apart from wearing mask, are people actually wearing it as it's supposed to be? People can even have the recommended mask, but how do they wear it? Because there are some guidelines for wearing mask. Before wearing mask, somebody's supposed to wash his or her own hand. After, when removing, an individual supposed to also wash their hands. And when wearing masks, an individual supposed not to be touching faces, touching the eyes and every other part. And this idea of people wearing mask, putting it below the chin, is also another wrong practices. So those are issues with masks. Masks are not the only measures. We still need to also complement it with hand washing and the contaminated places, and also at the issues, whether I like it or not, one of the best scientifically proven measure is social distancing. So I'm also, as we resume, we shouldn't assume that COVID has gone in Nigeria. It's still with us. I will advise people resume. I think that should be, apart from wearing of masks, there should be provision for social distancing, so that in an office where that used to take about 10 people, they can prioritize this in such a way that maybe at a time 5 or 4 people. So I will advocate that government should still be doing alternate days. Maybe if a particular set of people come on Monday, another set should come on Tuesday, and so on. We shouldn't just allow things to take chances, because this virus is still with us. So I think that's my personal advice. Wearing of masks is not alone. We need to complement with other measures so that people can be safe in their virus workplaces. Thank you.
Talking about opening up, there is the issue of international travel. And then you are in a controlled environment. Is that an aircraft? Is a compressed air in a cabin, and so on. And when it was just local flights, you had 1 hour, 60 minutes at most places in Nigeria. But international flights could mean 6, 8, 9 hours, where you are not only mobile, but you are in this compressed environment, and then you are required to wear this mask. Are there any medical things to watch out for to give indications that people might be getting into trouble? What are the things to watch out for if you have been wearing a mask for so long, and what are the things to watch out for that something has gone wrong?
Actually, first thing first, before someone can embark on international travel, that person must ensure that travel is essential. That's why that's the first thing. Is it really important? That's the first question. Then another thing is that if anybody that knows that he or she is sick should not also embark on that, because 6 hours of face masks it can be challenging to some people. And that is why I made mention of some recommendation as regards to wearing of face masks. It's not all material that can be used. I mentioned the 100% cotton and use of bamboo, because whether we like it or not, that is the protocol, and that is the requirement of majority of this airline. So it is important. Without wearing that, nobody will be allowed to go into there. The only people that are exempted from wearing masks is under 2 years old. And the importance of this baseline is that that some people are either asymptomatic or they are at pre-symptomatic stage, or which you cannot know. So the wearing of face mask is to prevent droplets through cough, talking, or sneezing from either spreading into the air to another person. So it's just for our own safety. And that is why, again, for those people that are not used to wearing of masks, it is advised that prior to their travel, so maybe some days or so prior, they should practice wearing of masks in their homes, maybe within the environment, in their locality, just to get familiarized with wearing of face masks before embarking on such journey. And another thing I want to say is that I don't think it will be appropriate at times to some individual to wear one mask for 6 hours. So in case somebody sneaks or somebody soil the face mask, there must be provision for that person to replace, that mask when on air. So those are some of the things we need to look into. And as I've said earlier, again, wearing a face mask is not enough. We also need other measures like social distancing within the aircraft. Also, and hygiene is also very, very critical when on air. So those are some of the things that we also need to factor in before we can guarantee safety in the aircraft.
Let me ask you a question that is fairly close, and a lot of people always wonder because it doesn't often get talked about, and that is the issue of frontline health workers like yourselves. Very earlier on, when we started this program about COVID-19, we had cases of health workers getting infected. But that seems to have died down, or is it that it's just not being reported anymore?
Okay, it is not that it has died. It's just that, at the beginning of the outbreak, there were a lot of misconceptions, a lot of things needed to be put in place. Some health workers were not trained on infection prevention control. Even those that were trained, some did not have the personal protective equipment. And so a lot of challenges, coupled with the fact that at the initial time, people did not know that asymptomatic cases can present, and people just assume that only people that have symptoms. So it took a lot of time for us to learn a lot of lessons. And from that, after learning some of these lessons, it will make the health worker more equipped. If you remember, even the Association of Resident Workers, they went on strike on two occasions just because health workers are not being provided with personal protective equipment, of which I think now all those things are now available. And apart from that, even the issue of testing at the initial time when we were always on the studio were abysmally low at that time. But now it has relatively improved, especially in Lagos State. So the idea of even knowing somebody's status is even better now compared to that time. And as I've said now, we now have enough equipment to wear. So that has actually reduced the knowledge. A lot of health workers have been trained. You'll be hearing ministers talking about it. So everybody is now aware, well skilled, well knowledgeable about infection control. I think that has also contributed to a reduction in the number of health workers that are being infected with COVID-19.
Thank you so very much, Dr. Jamiu, for your time this evening. Dr. Jamiu Ganiu is a public health physician, and he's joined us tonight from the Bagada area of Lagos. Thank you once again for your time, and you have a good evening.
Bye. Yeah.
The Nigeria Center for Disease Control, the NCDC, announced 148 new cases in the country from 13 states and the FCT. Lagos had 66 of those cases, the FCT 25, Oyo 13, Plateau 11, Kaduna 7, Rivers 6, Ebonyi 5, Ekiti and Ogun 4, Imo and Ondo 2, Edo, Nasarawa and Taraba all have 1 each. Till date, confirmed cases are now over 60,000, of which 52,194 have been discharged. In the meantime, 2 new labs have been accredited for inclusion into the private fee-paying labs for COVID-19 testing, both in Abuja, and that brings the number of private laboratories testing for COVID-19 to 21. 9 in Lagos, 1 each in Kano and Imo, 7 in the Federal Capital Territory, 1 in Edo and 1 in Anambra, 6 corporate labs across the Southwest, the South-South and Southeast, and over 60 government-owned laboratories. Outside our shores, South African President Cyril Ramaphosa yesterday presented a plan aimed at helping the economy recover from the rages of COVID-19 and the lockdown implemented to curb its spread. Addressing a joint session of Parliament, he unveils the plan 7 months after declaring a national state of disaster in South Africa in response to the global pandemic. Economists have been reacting to this recovery plan.
This plan directly responds to the immediate economic impact of COVID-19 by driving job creation and expanding support for vulnerable households.
In his plan, President Cyril Ramaphosa said the key objectives were to create jobs primarily through aggressive infrastructure investment and mass employment programs to accelerate economic reforms and unlock investment, as well as to fight crime and corruption. Makwe Masilele of Makwe Fund Managers says there is nothing new about this plan.
Truth be told, I think most of the stuff that has been mentioned is what we know already, and some of them they just changed the naming thereof. But we understand that, since the guy started with his stimulus package or plan in September 2018, when he mentioned stuff like he'll start auctioning the likes of the spectrum, so there's nothing much more the guy can come up with. And now, hence, even so, the market reaction, it was just okay. Markets will continue to be driven by international events. Even the rent itself, it didn't move at all. So it was at the mercy of a stronger dollar.
President Ramaphosa's recovery plan leans heavily on an expanded energy supply strategy and reindustrialization. He said his government will be accelerating the implementation of the integrated resource plan to provide a substantial increase in the contribution of renewable energy sources.
The government is in a tight spot here. It has no option but to allow for renewable energy. So in between being able to sort out ESCOM and get to the megawatts that there is needed for the country and the growth of the economy, since the economy is now growing, or basically is recovering and is healing from where it came from, that means that there's going to be more power that is going to be needed.
He also said the government is targeting 3% average annual economic growth over the next decade, and a presidential panel will be established to reduce the time it takes to make decisions on projects that could help grow the economy. But analysts are still looking at the question on state capacity and capabilities in executing projects.
Unfortunately, when it comes to the state, that are they able to deliver the capabilities, we know they don't have it. And have they mentioned anything going forward that this is what we'll do to try to make sure that we enhance it, and nothing was mentioned? So as long as we don't address those kind of things, then hence people will continue to have a doubt whether you'll be able to implement all these nice plans which are good on paper.
The president also committed 100 billion rand over the next 3 years to create jobs through public and social employment as the labor market recovers.
I think we need something about 1 trillion, which is just under 20% of 20% of GDP. Yeah, sorry, okay, of South African GDP. So we believe we should have half of that should be spent on a basic income grant, because unemployment in South Africa is heading towards 50%. And when you have 50% unemployment using the expanded definition, the whole society becomes unviable.
President Cyril Ramaphosa, however, didn't specify whether budget deficit targets will be revised. The Finance Minister, Tito Mboweni, is expected to release details in his medium-term budget on the 28th of October, 2020.
The World Health Organization has warned that Africa cannot afford a second wave of COVID-19, saying it would be devastating, especially to the economy. The warning comes as infections continue to spike in many countries that have been recently easing restrictions. The health body says the virus will run out of control if African countries continue opening up without adequate interventions in place. It also warned against a return to lockdowns, which the continent could not also afford. Africa has reported more than 1.6 million COVID-19 cases since the pandemic began, with more than 39,000 deaths. Saying that antiviral drug remdesivir has little to no effect on COVID patients' chances of survival. The drug's manufacturer, Gilead, has rejected the findings of the trial, saying that the findings on the study are inconsistent with others. A study conducted by the WHO evaluated 4 potential medications for COVID-19, including remdesivir and hydroxychloroquine. Remdesivir was among the first to be used to treat COVID-19 and was recently given to United States President Donald Trump when he was in the hospital.
The interim results from the Solidarity Therapeutics trial, coordinated by the World Health Organization, indicate that remdesivir, hydroxychloroquine, lopinavir, ritonavir, and interferon regimens appear to have little or no effect on 28-day mortality or the in-hospital course of COVID-19 among hospitalized patients. Although the results for the first 4 treatment options evaluated were unpromising, this global platform works well and is now available to rapidly evaluate promising new treatment options with nearly 500 hospitals participating as trial sites.
In the United Kingdom, Prime Minister Boris Johnson says he does not want to see the country constantly locking down, but each day that passes without action will mean more people dying. He wants that Greater Manchester residents will have Tier 3 coronavirus restrictions imposed on them, even if local leaders do not agree. Let's go more on this and other developments on our COVID-19 Global Update.
Local authorities with the mayor in Manchester, but it's up to
British Prime Minister Boris Johnson on Friday called on Manchester's local leaders to lend support to the government's plans to place the city under its toughest tier of coronavirus restrictions. Mr. Johnson said he paid tribute to neighbouring Liverpool and Lancashire for agreeing to entering Tier 3 or very high restrictions due to rising infection rates.
And this is about saving lives. This is about us joining together locally and nationally to get the R down, to make these regional restrictions, this tiering system work, and to save lives. And I think everybody in Greater Manchester and all the areas which are still finding it difficult should think about it.
India's COVID-19 cases has topped 7.3 million within the past 24 hours, bringing the total confirmed cases to 7,307,097. With 680 additional deaths of COVID-19 reported, the country's death toll of the coronavirus pandemic has reached 111,266. A total of 6,383,441 people have been successfully cured and discharged from hospitals, according to the data. Russia's daily tally of new coronavirus cases surged to a record high of 15,150 on Friday, including 5,049 in the capital Moscow, pushing the national total to 1,369,313 since the pandemic began. Authorities reported 232 COVID-related deaths in the last 24 hours, bringing the official death toll to 23,723. Banging pots and pans, some 1,000 hospitality workers rallied in Barcelona's Old City on Friday to protest against the 15-day shutdown of bars and restaurants ordered by the Catalan regional government to contain a surge in COVID-19 infections in Spain. The protesters, some carrying flags proclaiming young people have a right to work, converged in front of the regional government headquarters in the historic San Jaume Square, while some threw eggs at the neighbouring City Hall. Under the new restrictions reminiscent of a nationwide lockdown in March to June, bars and restaurants across the wealthy northeastern region, popular with tourists, may only offer takeaway and delivery services until at least October the 30th.
That's our COVID-19 update for tonight and indeed for the week. Please visit our website, channelstv.com, where some of the global and national figures, as well as the stories and safety protocols to have better understanding of what is required to stay safe, could be checked. We'll also have there other stories not related to COVID-19, but in fact politics, business, and sports. We'll be back on Monday at 6 and at 9. Thank you so much for watching. I'm Ladi Akere Duluale. Do have a good weekend ahead and stay safe. Good night.